What is an endometrial polyp and do they come back? I'm Dr. Natalie Crawford, a board certified fertility doctor, and one of the most common surgeries I do is to remove an endometrial polyp. An endometrial polyp is a small growth of endometrial tissue that is projected into the endometrial cavity. Vast majority of the time, these are benign, but they can be malignant or they can have cancerous cells in them. We always want to remove them if we find them, especially if we have symptoms like infertility or abnormal bleeding or spotting. Polyps do not typically cause any pain, and 10% or 15% of them are totally asymptomatic. We find them a lot in fertility treatments, and we are worried that the presence of a polyp can cause some inflammation inside the uterus and decrease the rate of implantation. So when we find one, we always like to remove it. But up to 40 to 50% will come back. And the more polyps you have, the more likely you're going to have more polyps come back. So we usually say recurrence rates are anywhere between 10 to 50%. So 10 to 50, that's quite a lot. So if you have a polyp, just know they may come back again in the future, especially if you're still ovulating or making estrogen, as estrogen is one of those risks. Importantly, if you have PCOS and you know it and you have very irregular cycles and you're not on anything to control them, having polyps grow that have an abnormal rate of atypia or cancerous cells is a problem. So patients with PCOS with very irregular cycles, not on hormonal treatment, have a higher risk of endometrial cancer. So that's why it's so important to make sure you know your period is normal. If you have spotting, you get it checked out. If you're missing periods or they're really spaced out, you know that you don't need any further treatment or evaluation. But the vast majority of the time, the surgery is quick, easy, and hopefully they don't come back.